Spend all your time waiting for that second chance, for the break that would make it okay.
Trauma-informed care means recognizing that people often have many different types of trauma in their lives. People who have been traumatized need support and understanding from those around them, especially caregivers, family members, and supervisors. Often, trauma survivors can be re-traumatized by well-meaning caregivers or misunderstood by friends and family. Oftentimes, veterans fear retaliation by their commanders for seeking mental help. Whether it's real or perceived, there is still the idea that seeking help is going to hurt a person's military career. This atmosphere of fear and hopelessness needs to change so veterans can receive the help and support they desperately need. The goal of trauma-informed care related to all individuals in the military include creating a fostering environment for veterans to seek help, recognizing specific triggers, promoting safety and a feeling of well-being, offer practical help for specific problems, and preventing support system breakdown.
In the arms of the angel, fly away from here.
Risk factors for emotional or psychological trauma are: it happened unexpectedly, you were unprepared for it, you felt powerless to prevent it, it happened repeatedly, someone was intentionally cruel, and it happened in childhood. Emotional and psychological symptoms of trauma include shock, denial or disbelief, anger, irritability, mood swings, guilt, shame, self-blame, feeling sad or hopeless, confusion, difficulty concentrating, anxiety and fear, withdrawing from others, and feeling disconnected or numb. Physical symptoms of trauma include insomnia or nightmares, being startled easily, a racing heartbeat, aches and pains, fatigue, difficulty concentrating, edginess and agitation, and muscle tension.
Trauma-informed approach and trauma-specific interventions are designed specifically to address the consequences of trauma in the individual and to facilitate healing. Trauma-informed approaches reflect 6 key principles: safety, trustworthiness, peer support, collaboration, empowerment, voice and choice, cultural, historical, and gender issues. It is critical to promote the linkage to recovery and resilience for those individuals and families impacted by trauma. Survivors need to be respected, informed, connected, and hopeful regarding their own recovery. The need to work in collaborative way with survivors, family and friends of the survivor, and other human services agencies in a manner that will empower survivors.
That brings me to my...
The project concluded with the evaluation form rating the quality of information, knowledge of the topic, effectiveness of the Give Back project, and whether or not it made a difference. Staff and patients watched the video and received the pocket card. The general response was that the video was motivating, informational, and clearly depicted the soldiers' daily struggle with their past trauma. The card was given to each unit to be given to the patients upon discharge and instructed to put it in their wallet or someplace they could easily reach it when they are in a time of need. Whether it is at the grocery store, waiting at the bus stop, or in a crowded room, they will always have it. The patient can refer to the card and go through the acronym DO IT, as well as look on the back for resources that are readily available for them to call.
You're in the arms of the angel.
There are many resources available, including Military OneSource, Moral Welfare Resources, Substance Abuse and Mental Health Services Administration, or SAMHSA, National Center for Trauma-Informed Care, U.S. Department of Veterans Affairs National Center for PTSD, National Council for Behavioral Health, National Association of State Mental Health Program Directors, NCTSN Military Families Learning Community, Military Families Knowledge Bank, and Courage to Talk campaign.
Comfort.